Okay. Becky first asked me to speak. I said, what do you want me to speak on? And she said, anything. Which really narrowed it down. So I thought I'd go with something fairly straightforward, the highs and lows of treating reptiles. Why I am involved in reptiles in particular, I'm what is called an Advanced Practitioner in Zoological Medicine. And I thought before I started, it might be worth just explaining what some of those terms mean, because in veterinary medicine we have lots of terms and we don't actually know what they mean. So an Advanced Practitioner, that is one stage down from a specialist, and it means that advanced practitioners have done additional training, but not only have they done additional training, they are also recognised by the Royal College of Veterinary Surgeons at operating at a higher level than other vets. So all vets have to do 35 hours of training a year in order to maintain their registration. We have to do 50. 25 of those have to be in our designated area, and 10 of those have to be hearing from other specialists and advanced practitioners, so that we are constantly building our knowledge up. And now we've gone. What exotic animal practice is. This is something I think you guys realised when you became interested in exotics, that the terminology maybe to the public was not quite what we expected. Because zoological medicine or exotic animal practice from a vet viewpoint is anything that's not a cat, a dog, a cow, a pig, a sheep, a horse or a donkey, which is quite a number of animals. Poultry is a little bit of a grey area, but essentially it's any birds, certainly any birds that are not for meat or egg production, any fish that are not farmed fish, rabbits, ferrets, guinea pigs, rodents, hedgehogs, skunks, anything that mammals that people keep, anything that's kept in a zoo, anything that is wildlife, and importantly today, anything under herpetology, so I'm thinking of reptiles. So we have quite a lot to deal with. There we go. So we focus just on reptiles. It's nice and easy because there's only 12,000 species of them. So it's easy. And I'm sure this is teaching everybody stuff they know, but basically snakes, lizards, Coronia, crocodilian, and colonially separate into tortoises, terrapins, and turtles. My favourite line from a textbook ever is the first line in the BSAVA manual of exotic pets on crocodilia, which reads, "Crocodiles do not make good pets." Which the fact that someone had to put that in a textbook is slightly concerning. And it is just a number of the different species, not anywhere near the number that I've seen in practice, but just a selection of them. And they're all very different, they all have very different husbandries, they all have very different medical and surgical things that they are prone to. Even if we narrow that down, types of chameleon, a chameleon is not a chameleon, a gecko is not a gecko, tortoise is not a tortoise. Some people for that, I've got a tortoise, you know, what kind? Is it tortoise? Yeah, that does not help. Point improving. Not this particular fellow, but one of these guys was probably the first exotic animal case I saw as a qualified vet. And I'm going to hand you the question because the reason he came in because he wasn't waking up properly after hibernation. Never like to point out the problem with that.
We don't live in the tropics.
These guys are redfoot. They don't hibernate. The very fact that someone tried to hibernate is the issue. They basically just starved this tortoise for however many months. So, yeah, exactly what you were talking about in terms of education, misinformation. Not all tortoises hibernate. And the importance, another story, the importance of why knowing what a species is. Interesting fact, a human being on their period smells the same as a female iguana in heat. So if you have a male iguana, you have to be very careful who's handling that animal. And they can be up to 2 meters long, and they have big claws, and they have tails that go like whips. So you've got to be careful. And we had iguana booked in one day, and every single person in practice went around and said, "Well, I can't see it, I can't see it, I can't see it." And I went, "Well, it's okay, I'm not on my period." And I went in, and this is the fella that came in. Dead certain iguana, much smaller, much less sleep, not going to do you nearly the same harm, and not going to be worried about whether you're on your period or not. So knowing the species is really, really important. Again, if we look, let's just lower this down into Colonia, and here is not probably the smallest, but certainly not the biggest that you're going to see. These guys have very, very different challenges. The little guys here, trying to calculate drug doses that we can actually inject into these guys, it's incredibly difficult. And the big sulcata at the top here, the difficulty there, if he doesn't want to give you a leg, there is no way you're going to pull that out by yourself. So just giving these guys an injection into their leg is actually really presents its own challenges depending on how quick they are. Quiz time then. Here are 4 snakes. They're all going to come in. Which one are you putting your hand in? Which one are you not? Bottom one. Bottom one. Which one? I mean, I would recommend probably not putting your hand in either of those. Yeah, of those. Happy? Not happy?
Yeah, happy.
Happy? Yeah. So corn snakes generally going to be pretty okay. Hog noses, I won't worry about them. They are technically venomous. Yeah, it's a very mild venom, and they're rear flying, so they really have to go for you. I don't want to risk myself here, but snakes are the one thing I have not been bitten by yet in 50 years. It's alright. Green pythons, they're not venomous, but they do need to be fairly aggressive. We have one that came in through the RSPCA that was horribly dehydrated. So we put it in the Viv, put some water into it to rehydrate it, steamed it, and by the end of the day it was straight into the glass every time somebody walked past, so we made it better. We then had a difficulty of how do you get that snake back out. And then, yeah, we have pit vipers and similar, which are horribly dangerous. You do not want to put your hand into those. And the reason that's there is because when I was doing my Advanced Practitioner, our lecturer told us the story of being called by the police in Glasgow to go and see a snake that was floating down the River Kelvin. And he went in and he opened the box and he went, yep, no. And that's not a snake you want to be doing too much with. Why are species important? You guys know this is one of yours. These two pictures look very, very similar, obviously different species. This is entirely normal. These are calcium glands. This is not normal, this is a tumour. But if you don't know what's normal for your species, you wouldn't know that one of those is okay and one of those is not. So when we talk about those 12,000 species, it's not a case of learning lizard is a lizard is a lizard. They're all different. Geckos, the one brilliant thing about geckos is if they've got a massive tail injury, you don't need to worry about it because the tails will come off, particularly leopard geckos, but they'll tend to regrow them fairly easily. Not sure of other gecko species. You've always got to be careful though, because this can happen if you handle them badly. And if you handle them roughly and grab them by the tails will fall off. So they have happened to me once, but it's been unintentional. But yeah, if this happens to your leopard gecko, you do not need to worry about it. It does not need veterinary treatment, it does not need stitch. It's absolutely fine. And I'm hoping the video works because this is what you get left at the other end. If you've never seen it. Yes, yeah. But they're fairly active when the tails come off. Yeah. But if people don't know what's going to happen, it scares them. What species is that? I just love this. So, what can and can't we do with reptiles? Because basically anything we do with cats and dogs we can do with reptiles. Some of it's easier than cats and dogs, and some of it's harder. So we can absolutely knock them out. We can absolutely give them anesthesia. We can absolutely do surgery on them. So these tubes that we've got in are not the tubes we normally use. These are actually the catheters we normally put in dogs in order to give them medications their day. We actually use these to intubate. And they're actually much easier to intubate than cats and dogs because their windpipe and their esophagus are miles apart, and you're not going to put down a lot of treatment. How do we listen to the hearts of these guys? Because if we've ever brought a reptile into the vet, listening to the heart over scales is really difficult. what we can do is actually Doppler probe that we use for measuring blood pressure. We put that over the heart, and then during anaesthetic, the video runs. We can hear that. We can hear that heartbeat, so we don't need to be worried about keeping stethoscopes on and everything else. We just take that in, and we can hear the heart throughout the operation. We can blood sample them. Lots of pictures of different places. Blood sample various reptiles. We have lizards at the top where we tend to take from the vein of the tail. It is described taken from the abdominal central vein. I've never tried that. Tortoises, we can go jugular, we can go in the tail, or we can go underneath the carcass. Snakes, again, you can go for the tail vein, depending on the size of snake. That's sometimes okay and sometimes not. For big snakes, we do tend to actually take blood directly from the heart. That is usually done under anaesthetic for obvious reasons. What is in the textbooks is you can use this vein in the inside of a snake's mouth. You're a braver vet than I am. But this is a good one. We're talking about intubation. This is a good picture because there's the windpipe, and the esophagus is right the way back at the end, so you can see where you're putting those tubes. Much, much easier than say cancer dogs. Or people who are apparently an absolute nightmare. Okay, you're not vets. What is that leg okay or not okay? It is not okay. That is spectacularly fractured. And given the bone density of everything else, I think it probably is fractured rather than something else. This was dragging it with its foot slammed with their door. And it's not the person who slammed the door who presented it, it was then rehomed, and it was presented by the person who rehomed it because it wasn't walking on the leg. So, yeah, importance. One of the big problems we have in veterinary medicine is generally people do not trust their vets with their reptiles. And I think in a lot of cases that's probably fairly fair. But that's not an excuse to leave something that clearly needs attention without attention. Leaving that without pain relief, in my opinion, is entirely unethical. Tortoises are a nightmare patient to x-ray because they're covered in shell, and shell gets in the way of x-rays. So normally when we're looking particularly for respiratory issues, we take 3 pictures. Normally we do 2, so most animals would go kind of up and down and to the side. And tortoises, we do that, and we also do a kind of from the nose to the tail.
Hey! Flip now, say enough of them today. Hey!
This is the other view that normally we wouldn't say anything other than tortoises, and the reason for that is that it looks right on the left, which you can't do with anything else. How do we do it? We put them on something with their legs will reach the ground, and they can't run away. It's as simple as that. And then for the other views, we literally take them to a sandbag, and we put them in the for around 10 seconds. That's the extra line. The one creature we don't need to knock out to do. Okay, another x-ray. Anyone want to guess what's wrong with this thing? With it? Could be a tumour. So we've got this big white thing in the middle. Egg bound. There we go. So we see that. So this thing came in egg bound. We knew it was egg bound. And we milked some eggs out. We x-rayed it, went, missed one. And then, lo and behold, we can milk up the rest of the eggs. Again, egg binding in snakes. Often we can milk them out. They're much easier than colonial or lizards. And this terminology changes. And this is what we used to call secondary egg binding. So we have eggs present as opposed to this, which is called primary egg binding. And these are not eggs, these are follicles on the ovaries. So no matter how much medication you give here, those eggs are not going to lay because they haven't actually been shed out of the ovary, they haven't got a shell or anything else. So the only thing we can do with that is to do surgery. This was a 300-gram water dragon, so it's a pretty small patient to be operating on. There we go, there's the ovaries. And each one of these is a follicle that has ovulated. And as long as you don't burst those, then you'll be okay. Same old as ever, that makes a difference. Right, what's wrong with this fella?
His eyes collapsing.
Yeah, his eyes got something. Respiratory, yeah. Gloria, again, probably the easiest patients to tell with a respiratory problem because they can't move everything else. They have to move the legs and the necks out, and that is literally gasping for air. Really quite serious respiratory difficulty. Can be treated, he was treated, he got better. But this was definitely one that I think referred to a prognosis before we started. This is the chance that he wasn't very much. So, yeah, the good thing is we can get these guys better. Even these really sick animals, we can get better. Difficulties, very mentioned, teaching people about the importance of husbandry. And husbandry is one of these words that sounds like it's a simple thing, but it covers all of these things. What system are we keeping them in? We already talked about people who take tortoises and stick them in the garden. It's fine for a couple of weeks in the summer probably, but not much more than that. There is a continuous debate about rack systems for snakes. I do not think they're ideal. I've never yet seen a rack system that works. But lots of people who, particularly breeders, will be very, very keen on their rack systems for snakes. Size, we talked about. Temperature, not just temperature, it's temperature gradients, it's basking sites, humidity, microclimates, UV, not just our vision, but actually do we need to think about how high up or how high down our UV lights are, do we need to think about UV gradients. Diet, just because a green iguana looks like a dinosaur does not mean it's meat. Water, how do we provide water? Do we need to bathe? Do we need to drink water? Do we need to mist the enclosure? Because certain species will only drink water droplets of plants, they will not drink out of a bowl. Hides is important. Sometimes species will want to go into hides in order to shed, but just that they are able to escape from things that are stressful. Are there species that climb? Are there species that bury? Getting an arborals, tree climbing snake species, low viv, that only has the ground thing, is not appropriate. Its height needs to be able to climb. Few of our reptile species are social, but we need to think, are these social animals, or are they animals that should not be kept in more than one? Docking, we talked about turtles and terrapins. Actually, terrapins are not supposed to spend 100% of their time in water, they are supposed to have somewhere they can come out. Filtration, they are messy creatures, you have a really powerful pump on aquatic colonia tanks. I'm going to talk about and protection. It's all in good to go, yes, I've got a heat bulb in there, but if your snake is curling around the heat bulb and burning itself, that's not good enough. Try going through all that in a 10-minute consultation after you've worked out what's wrong with the patient, come up with a plan and put on medication. And this is why it's important. You may have come across the 5 freedoms. This is for a good while been the kind of underpinning idea of what is good welfare. It came initially from farm animals and it's kind of translated its way through, and it's the underpinning principle that was actually used in writing the Animal Welfare Act, which is 2006. This has been along for a long, long time. So all animals should have freedom from hunger and thirst. So by providing fresh water, an appropriate diet. So, just because you're feeding it does not mean that you're following this. It needs to be an appropriate diet for the species. It has to be the correct balance of diet. Any animal that comes in not just emaciated but horribly obese, this is not been met. Freedom from discomfort. So that's what we're talking about. Things like appropriate humidity, appropriate heating. Freedom from pain, injury, and disease. That should be fairly obvious. If we get our husbandry right, we should be avoiding most of that, but it is still bringing the animal to the vet when it's unwell. Freedom to express normal behaviour. What we're talking about burying and being able to dock and being able to climb trees. Just because you provide, just because you've got a tag that's set up or a vet that's set up that meets all those kind of basic standards does not mean you actually get the animal. And freedom from fear of distress, which is difficult because what my job is get me to put them out of their viv, put them in a completely different carrier, bring them down to the vet's where I think I need to end up. So freedom from fear of distress as much as we possibly can. So we're safe, there's be some interfering with animals. Ignore my scribbles down the side, but this is sometimes, so whenever I see a sick reptile, I will get them to fill out a husbandry form to go through exactly kind of how they keep the animal at home. And this is not uncommon to get that. I would say over 15 years in, generally the understanding of husbandry is a lot better now than it was 15 years ago. Rarely do I see things like leopard geckos coming in that are absolutely adamant do not require UV lighting. I do see less tortoises, although not none, that are just left to wander around when they go and get slightly sleepy in a corner in October, then they leave them to hibernate and don't feed them anymore. But I do get things like this. What heat source bring? Heat lamp. What's the temperatures? Empty. Are they thermostatic control? Yes. Well, if it's thermostatic control, how on earth do you know what the temperature is? No checking with thermometers, no idea what the humidity is. Okay, we've got a UV in. Okay. But people that just don't know what they're doing, don't know that information. This is what we were talking about beforehand. Yeah, it's all well and good to provide heat, so that if you haven't got that protected, you're going to get burns. And if your temperatures are not high enough, snakes will curl around heat bulbs, they will hurt themselves. And the important thing to realise, for a long time people used to think reptiles did not feel pain because they would do things like this. Thankfully, I think we've got it through to people now that that's absolute nonsense. They absolutely do feel pain, it's just the requirement for them to be warm is a greater driving factor than the factor to avoid pain. But this snake, this is one of the first heat burns I ever saw. And this snake went from being very, very placid animal to being horribly aggressive. Why did it become aggressive? Because every time it touched something, it was painful. Of course it's going to become aggressive. And it's not just snakes. That's pretty nasty. It get better. But again, not pleasant. And that was just heat bulb too close. We were climbing up the top, and we were far too close to the heat bulb, and we were burning ourselves. Other thing we see fairly commonly, carapace damage in tortoises. This is not a wound, this is a fracture. This is a broken bone. This is not something that you can just leave. Most common causes are dog bites, but things being fallen on. This little guy is torty at the bottom. He climbed into the gears of a reclining chair, and the owner did not realise until he went to recline the chair and heard him crunch. He did fine. He made a complete and utter recovery. But again, the most important thing, if we do absolutely nothing else with these guys, is pain relief, pain relief, pain relief. It's so important. And then what we do is we take all the broken bits of shell that are causing issues, we make sure nothing inside has been damaged, and then we bandage it up. Usually provide antibiotics, because usually it's in the dog bites, they're infected. And then I'll learn next time how we can repair this. And they can take a long time to heal. Like what you were saying, oh yeah, Grandma had one in the garden and it lasted for 25 years. Yeah, because it took 25 years to get sick. And the only thing that's true about tortoises being slow is it takes them a long time to get sick and a long time to get better. So these wounds can take up to 2 years to be completely healed and the shell also. And there's all sorts of varieties of ways to treat them. So people will use fiberglass, and people will use actually orthopedic things, they can use put bones back together in cats and dogs' legs. And people will screw bra hooks onto them and tie them together. I like this stuff. It's called cool liner. It looks like chewing gum. It's not chewing gum. It is actually used to hold long-term dentures in place in people. So we can stabilise the fraction with the light, strips of shell and light, we can put that over and it keeps it stable. And again, when we're talking about pain relief, actually keeping this fracture stable is as much pain relief as actually giving pain relief. And bandaging can be useful. It's sometimes we different with bandage on stopping their legs working, generally good. Hibernation, it's mentioned plenty of times. I blame Blue Peter for hibernation problems. We all grew up with George the tortoise going into hibernation in October and waking up in March. I'm pretty sure what they failed to mention was that George was not the same George every time. Because George did remarkably well for a tortoise that was hibernating for 6 months of the year in a box, in a garage. So here we go again. This is the same husband form. Do you hibernate? Yes. Thank you. We're not hibernating this year because he's unwell. Yes. Getting somewhere. For 5 to 6 months, that's too long. A Herman's tortoise should hibernate for about 12 weeks, working for about 8 weeks. So putting them down in October or waking them up in March is far too long. And then they did nothing to determine whether the tortoise was well enough to hibernate, or checked at any time through, or had any idea what was going on at the time they hibernated. And it will forever strike me as odd that people, not this one, but I see it commonly, that people will have all this well set up, well monitored temperatures and humidity and everything during the summer, and then in hibernation, sit them in a box and forget about it. And you go, why are you spending so long making sure your temperatures are right in the summer and then ignoring them in the winter? This is what happens when you Google how to hibernate a tortoise. And all this is wrong. This is the next one, probably over here. And we're not going to go into great detail about how to hibernate a tortoise. But do not eat a lot of this. Who's going to open the box and go, oh yeah, that looks good. Yeah, do not put a whole pile of tortoises straight into a fridge. That's not acceptable. Freezer components are not ideal. Happening stories of freezer components defrosting and drowning the tortoise. So important that we do it correctly. And we should not be hibernating at 1 year old, 2 year old. And we should be making sure that we monitor these tortoises before we go into it. I don't think I need to progress with it. Monitor them before they go to hibernation and monitor them throughout hibernation to make sure they're staying well. Absolutely getting to you people the importance of how to look after their animal, and that every species is different. And it's a big challenge, and it's a challenge across all exotic species, not just reptiles, but certainly reptiles and to a degree birds, by far the most important, because if you get it wrong, you're really going to cause problems. Final slide was just the very boring slide on, I can't remember what it said, on actually how much legislation there is involved in all this, and all the different kind of laws and things that can be involved in keeping reptiles. So, Animal Welfare Act, yep, they're covered by the Animal Welfare Act, they're all covered by the Animal Welfare Act. We have a duty of care if we're keeping these animals to make sure we're keeping them properly, and to make sure we're meeting those 5 freedoms. Veterinary Surgeons Act, yep, still in play. There are a whole load of things that you are not allowed to do, including taking blood, doing surgery, anesthesia, prescribing medication. And we see that fairly commonly. Someone's had something that's ill, they've got a bottle of antibiotic, they pass it on to somebody else because their animal is sick. It's not actually legal. And Veterinary Surgeons Act covers them. CITES, definitely for certain species, controllable international trade of exotic species. Not for all, but for some, they should certainly have CITES paperwork. Dangerous wild animals, yeah, certainly. Anything that's venomous, or seriously venomous, anything that's particularly big and nasty, so most of the crocodilian, you have to have a dangerous wild animal license. That needs to be approved by council or government and by a vet. Zoo licensing, if you have exotic cases that are open to the public for, I think it's over 6 days of the year. You have to have a zoo license, although you can get an exemption from that if you apply for it. And there's the invasive species list. So exactly what these guys are reporting. You can't just go, I'm fed up with my bearded dragon, chuck it out into the wild. It's not allowed. Under the Animal Welfare Act, it's not going to survive. But secondly of all, it's not legally allowed to release it. So there's a whole load of legislation that, as vets and as a charity, we need to be aware of, and a whole pile of things that we can make sure we're compliant with as well. And that's just a run through of some of the high points, some of the low points, some of the questions that we're thinking about constantly when we're treating reptiles. Any questions? That's either a good side or a bad side. Yes.
I'm going to do a talk for my students, please.
Yeah? Yeah.
I was just going to ask about hibernation
Mm-hmm.
versus wintering that we talked about.
We have a chat about that. And there's lots of current advice is, sort of getting back to us that we will wait around talks.
Okay.
In a temperature, if their environment is wild, has particularly mad, they will bring it anyway. So we'll have it.
It's, that's the first thing that I always say to people when they come in for hibernation chat is there is absolutely no need to hibernate. And the
I
reason,
said the right thing.
yeah, the reason they hibernate in the wild is because the temperature and the food availability and everything else is not there. If we're keeping them in captivity, we can provide that. They'll need to hibernate. They will get smaller, they will eat less. So overwintering gets the temperature that's not going to be very consistent throughout the year, but there's absolutely no hibernation.
Yeah.
How long have you been a reptile vet?
Reptile vet, so I graduated 14 and a half years ago, and even when I was seeing placement, as I was training, I did a lot with reptiles and exotics. Interestingly, any exotics vet will start in an area, so there'll either be kind of a small mammal vet or a bird vet or a reptile vet, and then kind of get everything. I started with reptiles, and that's what I like. And then I ended up in a practice where they had somebody who saw a lot of rabbits and small mammals, and they left, so I got all the rabbits and small mammals, and then the birds came, and I had absolutely no idea what to do with things with feathers, but then I learned, and I think when I talk to vets, what I say, because I think generally the exotic teaching, certainly when I was at university, was atrocious. I think in my clinical year I got 3 hours on reptiles. Yeah, 12,000 species, 3 hours. Yeah, I'm gonna have. I got 3 hours on birds, I got 3 hours on small mammals, a little bit more on rabbits. So unless you've got an interest, your knowledge of these species is going to be pretty dreadful. But the basic things, if it's painful, it's pain relief. If it's got a wound, the wound needs either closed or at least bandaged until I can go and see someone who knows about it. So all vets should be able to do the very basic things, in my opinion. Or at the very least should know somebody else who they can send them to. But yeah, I think it's that thing of the basics is the basics, but there's also most of the species. And emergency treatment is emergency treatment. So anybody should be able to give some basic advice in emergency treatment, and certainly all vets. We have a duty of care, and we should be providing emergency treatment or euthanasia to any species, or if it's out with our area, should have someone who can confirm and monitor. That is what the Code of Conduct of the Royal College of Veterinary Surgeons says. Is it always followed? No, because I think vets, for that reason that they were training, it's got scales or got feathers, they don't know what to do with it. Or they're scared. Or they're scared, yeah, certainly. And we're going to be realistic with that. People do have snake phobias, bird phobia is fairly common, spider phobia. Arachnophobia, you know the word for that. But there are certainly some of these exotic species that people are like, no, I've not seen that. I will absolutely turn around and say that I'm certainly more scared of things like hamsters than I am of snakes, because I've been bitten by far more hamsters than I have any reptile, to be honest. The worst bite I ever got from a reptile was from a bearded dragon. And it was entirely my fault. I was trying to intubate it, so I thought he was asleep. I stuck my finger in his mouth to pull his tongue out and wasn't asleep. I don't blame him for that. That was my fault. I put my finger in his mouth. But if you've ever been badly bitten by a bearded dragon, they don't tend to do too much damage in terms of wounds. But my finger was numb for about 4 months. It took a long, long time for the feeling to come back. But yeah, that's a very long answer to 14 plus years.
Right, we're going to try and get this to work as we've got a video to watch. issues, because actually a lot of you guys are in it as well, so we're wonderful doctors and supporters in this video. So I'm going to try and make it work. If you want to take 5 minutes, just get another cutter and